already here. Our next speaker, Maria de Mello. Did I pronounce that right?
Some, Maria de Mello.
Okay. Okay, thank you very much.
No
She
problem.
will be taking us through an innovative wearable external catheter kit. And Dr. Maria has completed a PhD from Federal University of Sao Paulo, 1999.
Yes.
She's a senior medical scientific lead at ProvenMed, and she has led more than 500 research projects in Brazil. Welcome.
Thank you very much.
AG, we welcome you to this edition of our conference.
Thank you very much. And really is a pleasure to be here today. The team that's organizing this event is so kind and sweet, and really thank you for the opportunity. Can I share my screen?
Yes, please.
Okay. Can you see my screen, everyone?
Yes.
Okay.
If I can see it, everyone can see it.
Okay, I am a researcher from a Federal University of São Paulo in Brazil, and I came to Abu Dhabi as a researcher to make studies with the company called ProvenMed. And the first study that they asked me was to write a descriptive paper talking about the development of this device. And that's what I will present for us today. And so they started to develop this device actually because the cost of urinary incontinence in the world is very high. The incidence of urinary incontinence is pervasive throughout people of all ages and genders. It is associated with negative and treatment effects, both physically and psychologically. The annual direct cost of urinary incontinence in the United States in 1995 in dollars was estimated in 16 billions. And this number is increasing as the population is become older all over the world. They include routine care costs, not only regarding materials, but the number of hours that the nurse and caregivers people spend to change the devices and the diapers and things like that. Likewise, if the person is treated and become incontinent, treatment costs are incurred, but the routine, consequences direct and intangible costs are mitigated. The costs associated with consequences of urinary incontinence are harder to quantify. If we can, I have some knowledge in health economics, and if we start to calculate all the associated costs related with urinary incontinence is really very high. And men are more likely to experience urinary incontinence as they get older. And one of the problems of that is most of men, they believe that becoming incontinent is part of being an older person, and it's not. It's treatable, and we can use a lot of devices to provide them a better quality of life. And so, as we can see here, the prevalence of urinary incontinence increase when we become older, not only in the man, in the woman also. And so what is the current situation? A man with urinary incontinence use adult diapers, pads, external condom catheters, and intermediate catheters. Among all users in acute care, long-term care, rehab settings, home cares, and so on, there is an immeasurable desire to return to their lifestyles prior to the appearance of urinary incontinence. And an incessant search for a more comfortable, dignified solution that does not cause skin lesions and urinary infection, and it is cost-effective. And so what are the problems with the diapers pads that are being used by our patients today, nowadays? First, increase the risk of urinary infection, decrease functionality, high cost, It increases work overload, costing high in addition to demanding inventory area. The problems with the intermittent catheters. Complications and adverse events can arise in both men and human, but are seen especially in male patients performing intermittent self-catheterization for long term. And what are these problems? Blood on tip of catheter during catheterization, insertion difficulties, and this could make damage on the tissue, internal tissues, and so on. Removal difficulties, false passage, it's really very painful for the clients who has sensibility. Leakage in between catheterization, urinary tract infections. Just a minute. My slide's not going here. I have to go back to the, so sorry. I will stop share and I will start the slides again. Just a minute. I don't know.
No worries. Thank you very much.
Sometimes we just don't understand what's happening. Okay. Can you see my screen again? Are you seeing my screen?
We can, yes, I can.
Okay, thank you.
If I can see it, everyone can see it. Thank you.
Thank you, Philip. And so condom catheters are the one mostly used when it comes to improve functionality. And I didn't tell everyone, but I am an occupational therapist. And so my eyes are for functionality. And so what are the problems identified with condom catheters? High incidence of urinary tract infection among the users, skin problems caused by the condom adhesive, because usually they have to be glued on the skin of the penis, discomfort, insecurity, and the high cost associated of disposables, human and material resource, and all the environmental impact that they cause. And what are the existing products? First, adult diapers. And what are the effects, the negative effects? Psychological distress, skin rash, and infection. And we have a high cost related with nurse care, disposable cost, treatment cost. External catheters. We do have some models available in the market, and they work with adhesive, cause inconvenience, skin irritation, and infection. And all the causes are here. And the other type that is really hard, they are the enduring catheters. They are invasive, painful, and cause tract infection in many cases. Then now I will start to describe the steps that the company used to develop this new device that I am introducing to you guys, to us today. And so first they started to identify what were the stakeholders. Then they create a map to learn how to empathize with the stakeholders. Then identify how the stakeholders use it to act and how they should interact with the stakeholders. And then they developed the business model based on Canvas methodology. And then they create the aspirations and what they hope to accomplish. And so from the first step, stakeholders identification. This is the Canvas methodology that they used to identify the stakeholders and those who were the saboteurs, decision makers, economic buyers, recommenders. We are here, the recommenders. I mean, we as health professionals, influencers, we are also, and end users are our patients. And so the end users, who are the market goals? Who will be using the devices? Elderly and people who suffer from urinary incontinence. A second, people of determination. Here in UAE, they call person with disabilities, people of determination. I'm not sure how it's in Saudi, but in Brazil, we do call persons with disability in according with the United Nations. Uh, and then they identified another category of public that is a critical job front lines. I will explain more each one of these. And so elderly and people who suffer from urinary incontinence, then how they empathize with the stakeholders. To do that, the company Provimed used this empathy map to identify all the aspects relevant in developing the product. We will go through that. And then they developed the same map, but regarding the stakeholders. And what were the things that they identified? First, manage this issue comfortably and cost effectively is what they want. Socialize with confidence, because most of the users don't trust in the device, in the diapers or the condom devices that they use. Avoid embarrassment situations while being out. And so a lot of men with incontinence, urinary incontinence, they avoided to go out to have active life because all the embarrassed situation that they get through. And so they want to be active and practice sport, work, travel, enjoy, and be productive in society. And what they are using, most of them are using adult diapers and the condom catheters. And they are expensive to spend. They do expend a lot of money buying diapers and these catheters that most of the time they have to be changed every day. So in some cases, more than one time a day. And they don't have a lot of alternative solutions for these problems. And they would like to have an innovative solution that could transform their lives. And these are not the comments that they collected from the users, that diapers are really discomfortable. One of them said, "My life is gone. This is my destiny. There are no solutions. Infections and skin rash are caused by diapers and condom catheters," and things like that. And they do suffer daily challenges, avoid guests, friends, and social events because the incontinence. Don't talk about the issue at all. Most of them, they really feel shame when they talk about these things. And here, what they want, they look for innovative solution. They try to talk to the doctors to try to get better solution. Some who has the same issue tried to transform their lives, but they don't know how to do that. And we do believe that condom catheters and diapers were not supposed to be the only solution for them. I will go up. And here are the main goals: manage the issue uncomfortable with a high cost and without satisfaction. This is what the main claims that the Provimed collected from the potential users, all the stakeholders. And here is the goal that they follow to develop the new device. Manage the issue with comfort, confidence, and cost effectiveness. And so here, how the stakeholders act, in considering all these things that we just discussed here, and I described it to us. And so what they do, functionally speaking, manage the urinary incontinence issue, looking for the cost-effective solutions, they want to have active lifestyle, be safe from infections, manage the issue with ease and comfort, emotionally speaking. avoid embarrassing situations while being out, practice sports that they like, be active in society, be happy and confident, live with dignity. This is one of the most important. Social, looking for a comfortable solution, avoid infections and rash, socialize with confidence, manage the issue independently. That's another huge demand of them. Buy solutions anonymously because most of them don't like to demonstrate that they are incontinent. It depends. When they talk here about pains, they are talking about what causes suffering to the users of these devices. Paying a lot for a solution. Most of the solutions are uncomfortable. Facing skin problems like rash and infections. Can't find a comfortable solution for the issue. Face embarrassing situations. So here the pain that the users um, bring and what they want. Have confidence during daily activities, have a cost-effective solution, have an active lifestyle, not would you like to say something? Not worry about the issue and play sport without worrying. And they developed a way to interact with the patients based on all the information that they collect for the stakeholders. And I will go on. Then I can share this presentation with everyone who wants to go deeply in this point, but I really need to go on because our time. But in this here, we have like the summary of the needs identified and how the company worked to develop the device that I will introduce to us in a few minutes. And so here we have a kind of all the values that the company developed from the user's need. And first of one, they want to concept a boxer with ease of use have a positive social impact by a comfortable silicone assuring realizability, designed for patients' need with optimal comfort, and all that. We will talk more about all these things. And one of the most important is this one, a portable bidet for washing to avoid the infection caused by the diapers and all the devices or the catheters used for urinary incontinence. And so they articulated the value proposition to people with urinary incontinence, and they come up with the product active goal to help people with urinary incontinence who want to have a comfortable and active lifestyle by eliminating embarrassing situations and increasing confidence and independence. Unlike other solutions which are uncomfortable, cause infections to users, and limit their participation in the society. And from that, they developed this device here. We will see a short video. Designed to be attached with the home. Just a minute. I am looking for my audio screens. Just a minute. Anyway, the device was developed by a very specialized team. Let me stop sharing, start to share again here. Sorry about that. Um, and nowadays, this device is available in the market around the world, and everyone can buy the device through. Now it's stopped again. I'm so sorry about that. How you go back to here? And the problem, and my goal now in the company is to start to make research, really to a clinical research to prove the cost effectiveness and really to see, to verify scientifically, is this device is a solution that they are saying that it is. And so just a minute here. And so the differentiation, comparing the device that I just present to you to the others available in the market. And so relating with quality of life, the diapers and condom catheters are inconvenient. An active go kit is comfortable and ease of use. Psychological impact, distress and isolation, and active go, they provide confidence and active style. Infections and side effects, tract infection and skin irritation from the diapers and condom catheters, and active kit prevention from tract infection. At cost of usage, high disposables and treatment costs, and active go real usability and affordability. Environment, high carbon footprint, and here active go environment friendly. Where all this information came from? The company had run some case studies. I was not responsible for these case studies yet. At the time that they run this study, and they have this information, but it's not from a scientific point of view. With the ProviMed really need to increase the scientific information, and that's one reason why we have this partnership to help them to develop and build this scientific basis for their products. And what are the customer segments that can use the device? Elderly and everyone with urinary incontinence, persons with disabilities from 12 older and older, because they do have a device only for adult. They are developing for children, but doesn't have yet. And frontline critical workers that don't have the time to stop to urinate. And so the use of device is to enable the life to live a life to the fullest, active style, and for persons with disabilities, reduce dependence and improve social integration, and from the frontline critical workers to assure the productivity and reduce risk of bathroom and hold urine. And this COVID situation around the world has showed us that the problems of hold urine for the drivers and for the people that have in the ambulances and all the situation that they cannot stop to go to the bathroom. We are dealing with new problems that are coming from holding urine that already is available in the literature, and we can easily identify all these problems regarding holding urine. And what are the benefits for health network system that could come using this kind of device? Cost benefits and accessibility, saving in nursing time and materials. He has a building hygiene system, and so prevent urinary infection. A large urine collection bag facilitates drainage and allows to the user to increase fluid intake. Designed for patients' need with the best possible comfort, a universal size that fits everyone, and usually this is a huge problem for men who use condom catheters. Reliable, leak-free use with help them to go back to active life, increase the patient's functional independence, designed without problems with adhesives or other glues, and so prevent the skin lesions. Reusable solution and therefore more economical. Easy to use, gain confidence and health mindset. And so a solution, they tried to solve all the problems that they found in that empathy map that I presented to us here today. And so they try to guarantee out the wish that they identified from the users. But here we do have a problem because we don't have any research on its clinical use, patient satisfaction, and the impact of the quality of life of the use of these products. And so I'm inviting all of you and who wants to make single case studies or series of case studies to help to prove what this new device is effective or not. And I am designing a prospective cohort study to compare active goal performance with other external catheters. And I am really looking for research partner to help us. My dream is to have a multi-centric study around the world. We will develop in Brazil, in the university where I work, but I would like to have other universities and other research centers working with us, because I do want different culture point of view. The culture from the Arabic world is very different from our culture in Brazil. And so we do need a different point of view in developing this research. Here you have my email and my phone number. If anyone wants to help us in this research, I would love it. And the company is working in developing a new device, a smart device, and they are developing it, and then we will be in the market, and it will help a lot our work as health professionals. Not only to see what is going on with our clients in real time, because they will be connected all the time and transmit data real time to a central app. And so we could discover patterns and elect us and users about any related problem. And to use that, we could detect early stage problems. And so here is the team. Amin is the developer. He's the one who wrote with me the abstract to be presented here today. Thank you very much for the opportunity to be here with us.
Thank you very much. Thank you very much, Maria. And that's
very welcome.
You have done, and that is a great piece out there, because you've shown us, we know what the challenges we have with catheters within the hospitals.
Yes.
And the challenges patients have going around with them if they want to go in and out, or, they can't wear something. So it's a very good innovation you've done there. Because we are running out of time at the moment, I don't want to go through and repeat what you have already said. But thank you very, very much.
My pleasure. Thank you.
If there's anybody that have any contribution for 1 minute or any question before we go to our next speaker. Okay, we can see some comment from there. People are great topic, Dr. Maria, great presentation, Dr. Maria. Thank you very, very much. Still going to be here till we have another question and answer session later tonight. So if you can still collect your questions and we pass it on to the speaker. Mr.